Humanitarian access must be predictable, principled, and at scale. That's what humanitarian law says. And it cannot be conditional on political compliance or ideological tests or endangering staff. It's not optional. It's a legal obligation under international law. And right now it's being violated.
Israel is saying that these new rules are meant to enhance security and transparency to register aid workers so that Israel says it can suss out who has links to terrorism. Help us understand why so many aid groups like yours and Doctors Without Borders and many others are refusing to do this.
It would put people at risk. We're being asked to hand over highly sensitive personal data of Palestinian staff and their families, so including their kids, their wives, their spouses, without clear safeguards, without transparency. And that would violate our duty of care and international data protection standards. But this can't be separated from the context. Gaza has become the deadliest place on record for humanitarian workers. Over 500 killed during the genocide. In an environment where aid workers and our colleagues have been systematically exposed to harm. Transferring personal sensitive data to the same forces that have killed them would fundamentally increase the risk. So our responsibility is to reduce the risk to staff. This is not a procedural issue in the way Israel is framing it to be. It's about being asked to endanger people as a condition to deliver aid. No humanitarian organization should be forced to choose between protecting its staff and delivering life-saving assistance. We're committed to continuing our work, so we will stay in Gaza as far as we are able to. We'll continue working through local partners. We'll procure on the local market. Of course, these are suboptimal workarounds. They're slower, they're more expensive, and they're far less effective at scale. A humanitarian response cannot function when access is conditional on political compliance or when aid is deliberately blocked at crossings. This doesn't obviously undermine just us as Oxfam, but the entire architecture of the humanitarian response. And of course, the impact is on the communities. For families in Gaza, this will mean slower repairs and fewer supplies and longer waits for basic services. And it will affect direct access to clean water, for example, to shelter materials or to public health interventions. Communities are already facing hunger. They're already faced displacement multiple times over the last 2 years and disease and preventable illnesses. The impact is really not abstract. It's borne by the families that are already surviving day to day in Gaza today.